Hey everyone, my name is Dr. Sonam and I'm an interventional sport medicine physician in Canada. Today I'm going to chat with you about my step-by-step instructions on how to get ready for your cortisone injection. Now if you like the videos I produce, please like, subscribe, and share my videos so that more people can see them. A lot of my patients find them very helpful and I like to get this education out there. Number 1, eat and drink prior to your injection. So it's really important to eat and drink prior to your injection and don't come fasted. And the reason why is twofold. 1 is blood sugar and 2 is blood pressure. When you haven't eaten and drank anything beforehand, you're dehydrated and you don't have any food on board. This puts you at elevated risk of feeling faint or potentially fainting during the injection. Now, I do all of my injections with my patients lying down, so I don't have any issues with people fainting on me, but a lot of people do feel faint. And the older you are, the more susceptible you are to this. So make sure you eat and drink a good breakfast, a good meal before you come and see your doctor for your injection. Number 2, bring a buddy. This is really important for people when it's their first injection, mainly because they don't know what to expect. Now, for the most part, most people can walk in, walk out, and drive themselves home after an injection. But sometimes it's nice to have that extra bit of support, knowing that you don't have to get in the car and drive yourself back. So if it's your first injection and you're by any means worried about it, don't be afraid to bring someone with you. I highly encourage it. So number 3. Very important recommendation is try to avoid watching injection videos on YouTube, especially if you're at all queasy with needles and blood. I find that even though all of this stuff is amazing and available online, it can actually cause a lot more anxiety in people when they've never had the injection done before. Oftentimes they are worried about the size of the needle or how deep it has to go into the body. And I find that when I do hip injections on people who've watched videos online, they come in and tell me afterwards that it was much more better than they expected. Mainly because it was the anticipated anxiety that made the experience much worse. So I try to encourage patients to trust me, let them guide them through the process, and go from there. Number 4, wear loose clothing. This will just help kind of keep the area nice and comfortable before and after the injection. Depending on what area we're injecting, just dress appropriately for it. So if we're injecting the shoulder, easier to wear a tank top. If we're injecting the hip, wear loose clothing instead of leggings. If we're injecting the knee, try to wear some loose clothing that you can roll up. All of this stuff will make the injection process just that much easier. Number 5, prepare your schedule. So I highly recommend that people avoid going to work or doing a lot of physical activity after an injection. It's not uncommon to feel sore and achy after the freezing wears off a few hours later. And what can happen is if you go back to work or do a lot of physical activity, you can really flare things up and make pain a lot worse that same day. So I really do recommend that my patients book the injection so they don't have to work or do a lot of physical activity the day of the injection. Number 6, watch my aftercare videos. I inject PRP, cortisone, and hyaluronic acid in my practice, and I have prepared aftercare videos for each one of these injections, mainly for my patient population. I do encourage them to watch these videos prior to getting an injection so that they know what to expect afterwards. I will link these videos as well, whether it's up here and down in the description for you. This about summarizes my 6 recommendations on how to get ready for a cortisone injection. If you have any questions or comments, leave them down below and I'll get to them. And for now, that's all.